Well, here we are for another episode of Inside OSU. I'm Burns Hargis, and we are delighted to be here in the great city of Tulsa at the Center for Health Sciences, and we actually are physically with Howard Barnett, the president of OSU Tulsa and the Center for Health Sciences, but also physically in the cardiology unit, which is a mobile unit.
Correct. It's a joint venture actually with the OSU Medical Center, which is our teaching hospital that's owned by the city of Tulsa. And it essentially is to go out into rural Oklahoma and provide, through all of this amazing equipment, the ability for a cardiologist sitting at the hospital to examine a patient and diagnose any heart-related problems that he might have. The mission of the medical school here, the College of Osteopathic Medicine, is to provide doctors for rural and underserved areas of Oklahoma. And so this, not only are we providing the doctors, when we send those doctors out there, primarily primary care doctors, they now have this kind of facility coming to them and their patients to be able to augment their practice.
And it's not just rural. I mean, it's underserved.
Correct.
Whether they're in
Absolutely.
a city or in the rural areas.
And for example, here in Tulsa, we operate 6 clinics, and primarily they are no-pay or Medicaid population that we serve.
What are some of the other units here at the Center of Health Sciences?
Well, in addition to the College of Osteopathic Medicine, we have a School of Biomedical Sciences, a School of Forensic Sciences, and a School of Healthcare Administration. And I think we're going to see a little bit of both of those.
Good.
Or all those, rather.
We're here in the Clinical Skills Lab, and with me is Dr. Casey Schrum, who is the Provost of the Center for Health Sciences and the Dean of the College of Osteopathic Medicine.
Yes.
Welcome.
Thank you.
So what goes on in the Clinical Skills Lab?
This is where the first and second year students really learn to become a doctor. They learn about listening to heart sounds, breath sounds, and examining patients here in this room.
Well, there's a lot of other things going on
Yes.
here at the Center for Health Sciences. Why don't you describe those for us?
Yeah. Well, we are actually increasing our class size, so there's a lot of expansion, and this room is part of the expansion. We have increased our class size to 115 because of the need for physicians and the physician shortage across the United States, and particularly Oklahoma.
What I would like to do is bring in one of your students,
Yes.
Mark Keichel. Why did you decide you wanted to become a doctor?
Well, for me, I actually have a family history of doctors, so I had the opportunity to tag along and see the firsthand experience of patient care, both with my father and my grandfather. So it really allowed me to see the impact that a physician can make on people's lives, and I wanted to do that.
You decided to come to OSU.
Absolutely. OSU fosters a family environment here, and the students here really embrace that, and that allows us the opportunity to produce some of the most competent and compassionate physicians out around.
Now, where do you intend to do your residency?
Hopefully I'll have the opportunity to do one of the residencies that are offered here in Oklahoma. We have multiple ones across the state, especially in Tulsa and Oklahoma City, and I would be happy at any of those locations.
I know it's very difficult to get in any medical school, and you have lots of applicants, a lot more applicants than you can take. Is that correct?
Yes, we have about 2,000 applicants every year for our...
For how many? 115 slots now?
115, yes.
My goodness.
Yes.
And as I understand it, you've got a dream of growing even bigger than that.
If you look at the shortage of physicians in the state of Oklahoma and the number of graduates we produce and the number of graduates that OU currently produces, we can't begin to put a dent in the number of physicians that we need at the current rate, so we would like to increase our class sizes.
Well, Mark, good luck to you.
Thank you very much. Thanks for coming to visit our school.
You bet. With me is Dr. Robert Allen. Rob is the chair of the Department of Forensic Sciences as well as the director of the Human Identity Testing Lab.
That's right.
This is a very unique program that we have here.
We are one of only a handful of accredited graduate programs in the United States that leads to the Master of Forensic Sciences degree, and we're one of only 2 in the country that has a fully functional crime laboratory right downstairs.
Which is the Tulsa Police Department.
Tulsa Police Laboratory and Property Room.
How long is the program?
Takes on average about 2 years in a summer.
What's the job market like?
Fabulous. Absolutely fabulous. The National Institutes of Justice in 2004 or 5 published the results of a needs assessment among crime labs nationwide, who said that for the foreseeable future, a 10% growth every year in this field was to be expected. And if you read the newspapers or listening to the news, you know there's a huge backlog of unsolved cases. And those unsolved cases are unsolved because they don't have the manpower that's trained to process them all.
Now, it's not just for those seeking an academic degree. You're also training existing professionals, are you?
You betcha. We're one of the few schools in the country that has a sexual assault nurse examiner training program for nurses, primarily in rural Oklahoma, so it fits perfectly within the mission of the College of Osteopathic Medicine. These nurses may see one rape in their entire career, but when they see it, they better get it right so that an assailant doesn't get to walk free.
I understand. In fact, we're going to go across the hall here, and I'm going to get a little demonstration of blue light technology.
You bet. It's just a blue filter over a plain old light that, because it filters out some of the light rays, what's left gets absorbed by body fluid stains and fluoresces bright yellow. And you're trying to identify evidence that may be useful to investigate the case, something that's quick and easy and most importantly cheap, and it makes everything more efficient, and yet it's a pretty good tool.
We need to get to what a human identity testing lab is, because that happens to be where we're
Right.
standing.
It's basically a facility that's divided in half, a clean half, where all DNA extraction takes place, and it's kept scrupulously clean to prevent contamination. This is the dirty side of the lab, where the actual analysis takes place on these instruments that are known as genetic analyzers. These instruments actually produce the printed record that is the DNA profile.
You also collaborate with OSU Stillwater, I understand.
We do. There is a group there that actually takes into account faculty in food safety or food science, plant pathology, extension, etc. Many different diverse areas of the Stillwater campus into the National Institute of Microbial Forensics. It is a collective effort to establish preparedness to a bioterrorism outbreak that targets our agricultural enterprise.
Dr. Robert Allen, thank you very much. Howard, it's clear that the Center for Health Sciences and the Forensic Science program are about a lot of different things, health and healing, but also discovery and law enforcement. So this is a very special place.
We're very proud of what we do here and feel like, as you've often said, it fits right into OSU's mission. We're very proud of that.
Well, that's another edition of Inside OSU. We really appreciate the hospitality, Howard.